Welcome back. January is Cervical Cancer Awareness Month, and according to the American Association for Cancer Research, more than 13,000 women are diagnosed with the cancer each year. Here to tell us more about some of the treatments available out there is Dr. Fernando Riccio. Thank you so much for being here with us, doctor.
Oh, it's a pleasure.
So what are some of the things that women should be looking out for when it comes to cervical cancer?
Well, unfortunately, cervical cancer often doesn't have any signs or symptoms until it's advanced stage. And that's why screening is so important. But sometimes patients may have irregular bleeding or discharge, pelvic pain, pain with intercourse.
So the screenings, when should we start doing that, and what is that process like?
So screenings typically start at age 21, and it just involves a speculum exam, looking at the cervix, and doing a pap smear, or just scraping cells so that the pathologist can look at them under the microscope.
Which is now every 2 years, correct? I know some doctors go back and forth between the 1 and the 2.
We sort of are, individualizing it to the patient depending on what their history is in terms of having abnormal pap smears, but in general it's every 3 years in patients under 30 and can be done every 5 years in patients over 30.
What are some of the risk factors?
So, risk factors, the big one is having the HPV virus. Okay, we know that, that virus is sort of implicated in almost all cervical cancer. Now that virus is ubiquitous, meaning anyone can get it, and probably 90% of sexually active individuals are exposed to it and infected with it during their lifetime. The other big one is smoking. Smoking weakens your immune system and sort of potentiates the HPV. That's the one modifiable risk factor. If someone is known to have HPV, I always tell them that they should quit smoking.
You're talking about HPV. I wanted to ask, how effective is the HPV vaccine?
The HPV vaccine is extremely effective. Right now, the vaccine available in this country covers 9 strains of HPV, and nearly all individuals that sort of get the vaccine before starting sexual intercourse get antibodies to those strains, and it reduces that individual's risk of cervical cancer probably by 90%.
What about doing the vaccine after you've had sexual intercourse, maybe at a later age?
It still is effective. It's not as ideal, but there still is effective, especially since it covers multiple strains.
What are some of the advancements and treatments out there right now?
So we've come a long way in terms of imaging modalities and radiation techniques that sort of target just the tissue or the tumor and minimize the radiation effect to the surrounding tissue. We're also giving immunotherapy for patients with cervical cancer. Tumors develop sort of mechanisms to evade our immune system, and we're able to sort of block that with immunotherapy, drugs like Keytruda, and that's been shown to improve survival in cervical cancer.
All right, Dr. Riccio, thank you so much for stopping by. If you'd like more information or to watch this interview again, you can head to our website, WPBF.com, or download our free WPBF 25 News app.